Hi everyone, I'm Celeste Luna. I'm a marketing strategist at BSA. I'm joined today by Dr. Michael Bedward.
Good morning.
He's one of our cardiothoracic surgeons at BSA Cardiothoracic Surgery, and we're going to be doing a discussion for Heart Month. So, Dr. Bedward, if we could just start with what interested you in the field of cardiovascular services?
Well, I became interested when I was in medical school, still learning about anatomy, and the heart and the chest seemed to interest me the most. And then I had some family that were also interested in it from a patient perspective.
Okay. And so how long have you been doing this?
21 years this August.
Wow. And you've done about 5,000 surgeries, is that correct?
Probably, yeah. I stopped counting a few years ago, but yes.
Okay. And what are some of the common conditions you treat?
Heart blockages in their vessels, so bypass surgery, treat bad valves, any problems with your lungs, tumors in the lungs, diagnosis of lung diseases, and then any other heart-related problems.
Okay.
And aneurysms, I should say, too.
And so in your time working with hearts, can you kind of speak on what the importance of heart health is as it affects your overall health?
The heart pumps blood to every organ in our body, every muscle in our body, every bone in our body. So heart health really affects us completely, whether that's your kidneys to your brain to your eyeballs. So the healthier your heart is, the healthier you'll be.
Great. And so what are some of the common risk factors that people might have for heart-related health issues?
The biggest things that we can change are dietary modifications. So if you're eating too much of a bad thing, that's always not good. So try to avoid heavy amounts of fried foods, fats, and things like that. Moderation is definitely the key. Then exercise is always good. The things that we can affect also are don't smoke and try not to drink to excess. The things that we can't affect is our genetics, and sometimes family history, diabetes, and things like that are the things that we can't affect, but we can modify by being as healthy as possible.
Okay, great. And so, it's about to be spring, so what are some exercises or outdoor activities that we could do to kind of optimize our heart health?
Walking is always the best place to start, whether it's just this quick stroll around the block or getting on a treadmill or heading out to the canyon for a nice hike. All of those things are very good. Also, if you can do resistance training, weights, resistance bands, that's also very good for your overall health as well.
And how often should we be exercising?
I always recommend kind of going with your primary care doctor's recommendations, but I would say at least start off once to twice a week, build up to 30 minutes a day if you can.
Great. And so can you just kind of describe what cardiothoracic surgery is? I know it's a pretty big term, and so if we could just kind of break it down.
Sure. Cardiothoracic really means surgery of the chest and heart. Some people specialize in just heart, some people specialize in just chest or lungs and the esophagus. But overall, it is a surgical specialty focusing on the heart and the contents of the chest, which is usually the lungs, the esophagus, the larger blood vessels, the aorta, and things like that.
Okay.
But it's typically 4 years of medical school, 5 years of general surgery training, and then 2 to 3 years of cardiac training.
Great. And so when somebody might qualify for cardiothoracic surgery, how does that patient process look like?
Say, for instance, you've experienced some heaviness in your chest, some unusual feelings. Then you usually will either present to your local doctor, and they will refer you on to a cardiologist or a pulmonologist if it's a lung-related condition. And then typically you'll start with a stress test, possibly an echocardiogram, and that may lead to either further intervention like a cardiac catheterization.
Okay. And so your practice is referral based, correct?
Pretty much, yes.
Okay, so the patient is going to talk to their pulmonologist, cardiologist, and then they'll gain a referral.
Mhm.
And then once they gain that referral, do they come to your office and talk to you, or
Yes.
what does that look like?
Yeah. Typically, we'll set up an appointment in the office, or say, for instance, you unfortunately had to come into the ER, then we would see you there or in the hospital. But usually, it's through your referral into the office.
Okay, and so for cardiothoracic surgery, is there an average time that surgery takes in recovery, or does it differ based on the condition?
Differs a little bit based on the condition, but say for the average bypass surgery, it's probably a 3 to 5 hour surgery, and then maybe a 4 to 5 day stay in the hospital afterwards.
Okay, great. And we've actually gotten a couple questions from our audience. So we were asked, what are some of the measures that you've taken yourself, Dr. Bedward, to become more heart healthy?
I try and exercise at least 3 to 4 times a week. I should be better. I don't eat much in the way of fatty foods. I try and stay away from a lot of fast foods, but they're usually my favorite, so sometimes it's hard to do. But exercise and just trying to keep a healthy lifestyle is probably the easiest thing to do that's worked for me.
Yeah, it's always a challenge.
Yes,
to keep to.
yes,
You
it
can
is.
definitely say it, but then in practice,
Yeah, exactly.
Yeah.
And I can always find something else to do. I can always say, oh, I'm busy at work.
Yep. And so, with work, sometimes that can be stressful. So another question we got was, how does stress impact your heart health?
Stress can impact your heart health quite a bit, honestly. There are healthy levels of stress, but most related is higher cortisol levels can take a real effect on our overall health, whether that's through higher blood pressure, high sugar levels, lack of sleep, lack of motivation to exercise, and just overall mental health. The higher your stress level is not good.
And what are some ways we can lower those stress levels?
Exercise is a great way to do it. Just to kind of zone out of your own head and just kind of focus on one step in front of the other, or whatever weight you might be lifting. And then excellent sleep as much as you can. Try and regulate your sleeping. And then also just some quiet time, whether that's just reading a book, a little meditation. Some people enjoy yoga. So those all will help to reduce your stress levels and help your overall health as well.
Okay, great. And, talking about sleep, how many hours are recommended? I know that we're going to be hitting time changing pretty soon, so how can we regulate those processes?
Right, the easiest way is to schedule your sleep. Same time every night, same time every morning. Try not to try and catch up on sleep. Doesn't really work that way. Try not to sleep in on the weekends. It doesn't help that much. It's always good to try and relax, obviously, and take a little bit of a break maybe on a Sunday morning. But if you can regulate the time you're going to bed and the time you're waking up, it will help the most. 7 to 8 hours a night is probably best. And try and stay away from what we're doing. No cell phones, no TV for about an hour before bedtime, because the light from a screen does affect how we're able to sleep.
Okay. And so when we're talking about ways to prevent heart conditions, I think typically we start with the primary care physician. Can you kind of speak on the importance of that first step into avoiding further chronic conditions forming?
Preventative medicine will probably get you the furthest as far as avoiding seeing me. Taking care of your overall health, whether that's if you have some low-grade family history of diabetes, or a lot of family history of diabetes, that's a big place to start. What they call metabolic syndrome, avoiding the things that lead to type 2 diabetes, high blood pressure, high cholesterol, all of those things your family physician, your primary care doctor or provider can help you to either avoid or at least start treatment early.
Okay, great. And if somebody does end up coming to your office and needing surgery. Can you kind of talk on how you form patient bonds to kind of reassure? Because, surgery can be a scary ordeal.
Yeah, it's a big thing. So I think the one is very similar to what we're doing now, sitting down and talking about what the issues are, not only the anatomic problem that I'll be treating, but what other family factors are going on. Is there a lot of stress in the family right now? How can we help that, but also treat what we're needing to do? And then just explaining what's going to be happening along the way. A lot of times the fear of the unknown is adding a lot of extra stress that may not be necessary and can be avoided if we just talk about it.
And if somebody is wanting to know more information about cardiothoracic surgery and what you offer, what's the best way for them to find out more information?
You can contact my office. That's a good way to start, and we can kind of direct it from there. The American College of Cardiology, the Society of Thoracic Surgery are more focused for professional training, but each of those has public guidelines and education to it. And both are easily available on the internet.
Great. Well, thank you so much for
Thank
joining
you.
me.
I appreciate
and
it.
Thank you for joining us today. We'll be back with more heart health discussions throughout the month.